sada u tematsko područje koje nas vraća u 21. I još dalje idemo u svijetlu budućnost, projekt inovacije tehnologija u zdravstvu. Je li oksimoron ako u istoj rečenici imamo i umjetnu inteligenciju i empatiju i humanost? Nužno jedno isključuje drugo, ili upravo tehnologije zasnovane na umjetnoj inteligenciji oslobađaju u sustavu prostor da možete biti efikasniji, da možete biti učinkovitiji, to je ista riječ u stvari, i da možete biti u kontaktu sa onima koji dolaze tražiti vašu pomoć, pokazati empatiju i humanost. Dakle, predavanje Zdravstvo treba AI ili na hrvatskom UI, umjetnu inteligenciju, održat će viši direktor za digitalni ekosustav UGE Healthcare EMEA i čelni čovjek Edison akceleratora UGE Healthcare-u. Riječ je o gospodinu Janu Begeru. Ne znam zašto sam zamišljala da je gospodin Beger stariji. Ne. Welcome.
Thank you very much.
Iskenirajte QR kod, imate mogućnost postaviti pitanja putem aplikacije Slide, onda ćemo pri kraju predavanja pročitati sve.
Thank you for the kind introduction. Hey everyone, I hope you're well. In my daily work, I focus a lot on primarily two questions. One is, how does this technology, artificial intelligence, change healthcare? And secondly, what do we need to do as an industry to make sure those great AI-powered technologies are truly adopted in healthcare settings and by healthcare providers. So the next couple of minutes, I'd like to talk with you about why our industry needs healthcare. I explained a couple of different reasons, and hopefully at the end of the talk, you also understand the very likely impact of this technology over the next couple of years and decades. So, first of all, I'd like to start with a couple of interesting data points. Look to this. When we think about all kinds of medical information globally, today it just takes 72 days to double all medical data or medical information. Picture this, this velocity, right? Compared to like a couple of years back where it took 3.5 years. So massive amounts of data we have to deal with in that industry. Also an interesting number, about 30% of the world's data volume is somehow health-related. When we look into like medical publications, for instance, every 26 seconds, some new medical article is published. Put yourself into the shoes of a dermatologist. If you want to keep up with literature in dermatology, you would need to read 3,900 scientific papers each and every year. And it gets even worse. If you are a general practitioner, you would need to read for 21 hours every day to keep up with primary care literature. Impossible. So this massive amount of data we have to deal with, which today often is like a burden. It's a massive cost for healthcare institutions. They have to store patient data for certain amounts of time, right, which is related to cost. It's a huge struggle often to manage that data properly. But at the end, it's also a huge opportunity to leverage that data, right, going forward for like research use cases and so on, and apply artificial intelligence to it. Another example, right? So this is a so-called mammogram, an image of the woman's breast. And such an image contains more information than the telephone book of New York, even if I don't know if there's still like a physical telephone book. And it can easily go up to 1 gigabyte in size. So massive amounts of information. Let's look to those people who read and review those kind of imaging cases, the radiologists. As you can see here, in a 12-hour shift, they read about 50,000 images. Translated right into what it means in terms of time, it's less than a second they have for a single image, compared to like just 500 images 15 years ago. Right? And the company I work for contributes to this in particular because we produce better and better medical imaging devices, MRI scanners, computer tomography scanners, that are able to create thinner and thinner slices of the human body, and it's a reason for this as well, right? Why this number is that huge. Maybe another reason why, especially in this domain of radiology, right, there are so many images is eventually because radiologists usually always take 2 images, different orientations, right? Some of you know, to make sure we probably orient a lesion, right, or some anatomy in the patient's body. And actually, in this image, William is right. Only 3% of the healthcare data that's been generated is actually used to generate insights. Yeah? 97% of that data is untouched, unharnessed, unleveraged, and does nothing to really make an impact to patient outcomes. Yeah? Think about this. I now would like to move, right, just talked about data and this massive explosion of data. I want to talk about another problem we have in healthcare as an industry, and this is, let me call it medical errors overall, right? So I thought to compare it maybe with the aviation industry. As you can see here, there is a 1 in a million chance of a passenger in a plane being harmed while traveling on such a plane. When I've seen, right, the comparison to healthcare, I was pretty shocked because it's just 1 in 300. Yeah, so there's a 1 in 300 chance that a patient is harmed during their healthcare journey, which leads to estimations that up to 160,000 patients die every year in Europe due to medical errors. Next problem, something I'm sure that has been discussed already this morning, I think it's on top of all our minds, is the shortage of healthcare professionals, right? A problem we have around the globe, and something that, as you can see here, it's just going to get bigger, right? The WHO estimates that in 2030, we have a global shortage of 10 million healthcare professionals. But that's not all, right? I mean, on one hand side, it is a challenge for us as patients, yeah? But there is another issue to this because, and I'm sure you know this, we also have, right, other effects such as aging population, which leads to the rise of chronic disease, right? And this combination, right, all those different factors make it nearly impossible to deal with the amount of healthcare demand in the future if we continue operating healthcare the same way we do it today. Right, so I talked about 3 themes so far. Data, I talked about medical errors, I talked about the workforce shortage. I could have mentioned a couple of other things we deal with at a global scale, right? Cost of healthcare, access to care, right? There are many things, but I thought I'd pick those 3 because they are related somehow to digital technologies and AI, and where those kind of technologies can eventually make an impact. Look, one thing I want to highlight, and I'm sure you are aware already, is that healthcare is behind other industries in terms of adoption of AI technologies, but I would even say in terms of the digital transformation overall. Yeah? So when you, for instance, compare how you deal with, I don't know, booking your vacation, booking your flights, dealing with your bank account, right? It's very different to how you interact today with your health system. Yeah? So there's a lot of potential to change things going forward. But right, there is this technology I would like to talk now a bit more, artificial intelligence, which is, and some of you maybe follow, right, what's happening in that space just recently, the last couple of months or years. It's a very exciting, fast-paced field, and sometimes I just feel the day doesn't have enough hours because you just cannot keep up with what's going on in the space. Yeah? So Sam Altman, maybe the name rings a bell. He runs OpenAI, one of those very relevant companies right now. You probably have heard about their product called ChatGPT. And I think he's truly right. It's a great time to be alive, and I believe it's a great time to be in the healthcare industry, because in the next couple of years, we will see massive change. So let me talk about one kind of technology I guess most of you have heard about, called large language models, right? The ChatGPT and the likes. So as you can see, they become better and better, right? It feels like every week they become better, they become faster, they become smarter, they become more and more multimodal as well. I'll talk about this a bit later. And this is a great example, and for those of you interested, right, this has nothing to do with healthcare. That's another use case, but this one shows the power of this technology and what's capable of, and how it will impact our lives in the near future. This is just an example how such a chatbot acts as a personal tutor to a young kid, right, learning math. Very specific, very individualized, very personal, and I just wanted to share this with you. So I just mentioned the last couple of months, right, AI has made tremendous progress. And I wanted to point you also to this study where about 1,000 scientists have been asked, right, certain questions about when AI will be able to take over and basically automate specific tasks. And they have been asked in 2022, and they have been asked again in 2023. When you have a look to the right-hand side, you can see the blue dots indicate what their answers were in 2022, and the red dots are their answers in 2023. Right? And you can see we basically, with the speed of development and evolution we make in our industry, we shift left. Right? The future is closer, let me say it like this. So you probably also have heard that in a variety of different, let's say, industries, or let me say tasks, AI already reaches close to like human performance, right? And maybe in specific tasks, it already supersedes human performance. I wanted to show you this research as well. This is right related to the newest model from Google, right, called MedGemini. So that's a large language model fine-tuned for a specific medical use case, and it's able to answer medical questions. And as you can see here, it achieves a 91% accuracy. Pretty good. Yeah? My question to you now is, when there is a model out there, right, available to you that is 91% accurate, would you go to it? Would you trust it? Would you work with that? Probably not, right? Because it's just 91%, it's not 100%. Reality is, the human expert is not better. Yeah? So you can see 91% on the right-hand side, and next to it, you can see an experienced physician. Right? And in this kind of benchmark, they usually end up around 87%, and more to the left, someone who just left medical school is around 60%. Yeah? So we all know this, the human being is also not perfect, but the expectation always is, of course, technology is perfect. I wanted to show you also this gentleman, a pulmonologist in Texas, and he started using this product, ChatGPT, immediately after it came out in November 2022, and I was in touch with him in January 2023, so 1.5 years ago, and he started using it to write insurance denials with the insurance companies of his patients, yeah, to get basically the money for specific exams that are requested. Very powerful use case. It doesn't enter patient data into this, but the tool helps them write the body of those letters. Very interesting, like more administrative use case, right? And this is where across the globe, many healthcare professionals for a variety of different administrative use cases have used this tool, and it works pretty well, right? Where it does not well, and we'll come to this, is more in clinical use cases. Just another example, I think something that we'll see more and more in the future as well. This is something from a 19-year-old Stanford student, and he connected ChatGPT to the health app on his iPhone. And by doing so, he were able to have a voice conversation with his own fitness and health history. Meaning that, right, you can ask like, How did I sleep the last 7 days? What can I do to improve my sleep, and so on and so forth, right? And like such a personal wellness and health and fitness coach, if you will, I believe we all have in our pockets in a couple of years from now. I want to quickly introduce you to a friend of mine, Ellen. She I think it's her 2nd anniversary after breast cancer surgery and treatment. And what she did was also very interesting. During her care journey, she wrote a lot, right, about how she felt, about her experiences, about her emotions throughout the journey. And then she fed this into a so-called large language model. Yeah, so this is a tool, askellen.ai. You can find this on the web. You can find it when you scan the QR code. It's for free. It's available 24/7, right? And it's not the idea to give you like medical advice, not at all, right? But it's eventually a tool for a cancer patient or their families when they need some emotional support. And the feedback we have received so far is very powerful. I wanted to show you this use case as well. And during lunch, we briefly talked about this with some of you already. What you see here is like an extraction of a patient record. Yeah, so lots and lots of documents of structured, unstructured, tables with lab results, handwritten notes, and so on. And imagine if you are a physician new to a patient and you have to go through this to get like an overview about this patient. That's kind of heavy work, right? So imagine if we could give this data into such a model, and as an output, you get a 1-page patient summary, where you can quickly get an overview about a specific patient, right? And this is what this startup company basically does. So in a second, you should see how it looks like as a one-page summary. Yeah, so like this, basically. Another area where I believe AI will make a huge impact in the future is in like patient-doctor interactions. And I'm sure, right, all of you have been patients at some point, right, and maybe many of you are on the other side. And when you are a patient and you have a doctor's appointment, right, and you expect a conversation discussing, I don't know, your diagnosis, your treatment, and so on, during the digital transformation of healthcare the last 15 years, let's say, we have, as an industry, we have somehow broken this personal relationship and interaction between the physician and the patient by putting technology in between. And I talk here about a screen and a keyboard. Yeah, so what happens today is, right, the doctor is not hiding behind the screen, but sitting behind the screen, reading about you in the patient record, typing information of the discussion into that system. And imagine we could get rid of this. Imagine we could get to a, let me call it an ambient AI system that listens in the background, right, listens to the patient and doctor conversation and takes out all the relevant bits and pieces that have been mentioned and enters this in the system automatically, right? Getting rid of this kind of mundane, repetitive data clerk type of work. This is a more basic example, something we are working on at GE Healthcare. On the left-hand side, you can see a radiology report, which is something that is often written in a way which is hard to understand for the patient, right? So when I get such a report after an MRI scan, after a computer tomography or an X-ray, I often, as a patient who has no kind of healthcare background, I struggle to understand what my problem now is. Yeah? So what if we could translate this report written in like high medical terminology into something, into layman terms, so that the patient can understand? Yeah? Or, for instance, if you need follow-up treatment, right, surgery or something, don't send this full report, this long pages of text to the surgeon. Instead, just send them the relevant information, bits and pieces and data points they need for the surgery, for instance. Yeah? So when talking about AI in healthcare, I also need to point out that, as you can see here, radiology, right, the medical imaging domain is leading that field. Yeah? Both in building products with AI in healthcare, but also deploying, right, so adopting AI healthcare products. One of the reasons eventually is that radiology AI, right, is about imaging. It's so-called computer vision in machine learning, which is relatively simple to get done, right? So there are many more impactful use cases and potential in other clinical areas, but radiology is relatively simple, so therefore there's quite a lot of things that have happened the last couple of years. I want to show you a few examples, and I start with one that is not specifically imaging related, but has to do with radiology. And has to do, in my example, with MRI scans, right? Magnetic resonance scans. Maybe some of you have been in this big machine, right? It's not fun to be in there, it's noisy, it takes time, and so on. One of the issues healthcare institutions often struggle with is so-called no-shows, right? Or missed care opportunities, meaning a patient has an appointment for an MRI scan, but for whatever reason does not show up. Yeah? And very often, right, especially in MRI, where you have those coils and you have to set up the room properly for a specific patient in a specific type of examination, you cannot quickly compensate, right? You cannot quickly find another patient and move on. You have this gap where your device is idle, your staff is idle, and it's just waste of money and time. Yeah? So what if we could predict that a certain patient is likely not showing up? Yeah? And as you can see here, that would help quite a lot. I mean, in the US, right, we estimate that we can save up to $1 million for like a medium type of outpatient clinic. And here just at a high level example, right, so what we do, and this is ongoing research work with an academic institution, we basically take into account a variety of different data points, right, the patient's history, right, did the patient in the past also, right, in certain situations did not come. We take into account traffic data, right, weather data, and make like a prediction, hey, there's a likelihood a certain patient is not coming, and if you know this upfront, right, great, because you can do something about it. You can give a call, you can send a text as a reminder, and so on and so forth. Another example, also in radiology. Right? If you have been a patient in radiology, in computer tomography or MRI, you know you have to lay down on a table, right? And then this table moves into this thing, into this machine, and everything happens. Positioning of the patient is something that has so far also been very manual by a technician, by a nurse, right? Positioning you there and so on. And now this is also pretty much fully automized, which is a huge benefit because when you position the patient the same way, for instance, as you did last time at the same scan, for instance, if it's like a comparison to a prior examination, your images at the end are much more comparable. Yeah, so that's the idea. And it's faster than the human being positioning you on that table. I want to show you another great AI use case related to ultrasound. Right, ultrasound, and I show you one here, right? A fantastic imaging device. It's that small today, right, at least for certain use cases. No wires, no cable anymore. The smartphone is your screen. And with ultrasound, we have one issue, right? It's, as I said, it's very flexible. It can be used in any kind of healthcare setting, but it's incredibly operator dependent, right? It means you need to be trained to do ultrasound. You need to have a certain level of experience to get to high quality medical images. What we have done here is we have put AI into the scan process, and during the scan, the AI tells you how to move the probe on the patient's body to get to high-quality images. Yeah? So even an unexperienced healthcare professional can get to really good ultrasound images today. Yeah? And I think this is directionally something where we could eventually really democratize this fantastic imaging device. Another example in cardiac MRI. Yeah? So here you can see, I mean, MRI, I mentioned this briefly a bit earlier, right? It's not like a pleasant experience. Yeah? It's noisy, right? It's not just a nice place, it's not a nice patient experience to have. What we do here is, using AI, we reduce scan times significantly, right? So that, for instance, for cardiac patients who are usually really sick, yeah, and they have to often hold breath several times during such an exam, what if we could do this with just a single breath hold instead of multiple, right? So how can we use AI to reduce those scan times, to improve patient experience? That's a great field of work for us as a company. I also want to show you quickly this device, a mobile X-ray machine, right? Maybe some of you have seen this, right? That's often in use on the ward, at the patient bedside, in the operating theater, right? It's pretty flexible. You can move it around, put it to the patient's bed, get a chest X-ray, for instance. Yeah? What we have done here some time back is we have put AI into that machine. And now, as soon as you have taken that image, it can indicate that there is a critical condition. Yeah, so, I mean, I just show you here a snapshot of the screen. The AI detected a so-called pneumothorax, right, a collapsed lung, something that for a radiologist is easy to detect, no problem at all. But when you think globally, there are a lot of regions where there is no radiologist 24/7. Yeah, and if the machine could tell you, hey, there is something, you should act quickly, right? It's better than waiting hours and hours until an expert looks at the images. Yeah? What we also do is, for instance, for endotracheal tube placement, right? The system automatically controls if your tube is placed correctly. Another example I wanted to show you is about segmentation of anatomies, right? I mean, radiologists, what they do a lot is, right, segmentation and taking out specific organs, putting them into 3D for the surgeon and those kind of things. You can see how technology has evolved over the last couple of years. Like 12 years back, you can see segmenting the liver was pretty bad and took quite some time, 16 seconds. On the right-hand side, you can see how far we have come, so great improvement in terms of accuracy as well as speed. Yeah, similar to like heart segmentation. In the past, it was pretty terrible, didn't work well, and now we are getting close to perfection. Another example I wanted to show you, I feel like this is something very important, and especially in AI, right, that conversations the last couple of years have always circled around the fact it is important that the human expert is in the loop, right? And this is still true, that's very important. But this is a company out of Lithuania. They achieved a CE mark for the first, what they call autonomous AI. And what this system does is it rules out from the radiologist's work list, from their to-do list, all chest X-rays that are normal, where there's no finding, where everything is okay. Right? And this is a huge chunk of the work of a radiologist every day. And and this system basically takes them away and manages them separately. Yeah? So we'll see more and more over time for specific, right, and narrow use cases where eventually AI will fully take over. So I feel like the last couple of minutes you got some experience in radiology, right? I talked a lot about radiology, and I want to test your knowledge now a little bit. Don't know if we can see this well. So this is a study from, I believe, 2012 or something like this, where a group of radiologists have been asked to review a certain set of computer tomography images of the chest and detect so-called lung nodules, right? So lung cancer, basically. Yeah? And what the researchers did on the last image of the data set, which you can see on the screen now, they put something on that image, something artificial on that image, that's usually not there. And it's an object that is 48 times larger compared to a regular lung nodule. And I make this image a bit bigger. And interestingly, more than 80% of the radiologists in this study did not see this object. I don't know if you can see it, but it's here, this little gorilla. Yeah? A little black gorilla, 48 times larger. Look, to be fair, maybe AI in that case would not have detected it as well, right? Because when radiologists look for lung nodules, they look for some specific patterns, right? And it's not in that framework. So a bit of unfair, and I just want to make you smile a bit. AI would also not have seen this eventually. So look, I don't want to spend too much time on that table, but what I want to show you and what I want to explain to you is all those AI solutions that exist today, right, in this domain of radiology, and there are plenty of those, right? For instance, the US FDA, they have cleared more than 850 AI products so far. Yeah? And they are all for very narrow and specific use cases, like AI to detect lung nodules, as I just mentioned, AI that detects a brain bleed, a pneumothorax, and all those kind of things. Yeah? And for us as an industry, as a community developing those solutions, it's pretty heavy work. Because for all those very specific use cases, we have to collect data, right? Build our AI model, test it, validate it, get regulatory clearance, and then we can sell it eventually to customers. And if I have done this for my very first project as a startup, for instance, and then I want to move on to the next anatomy or pathology or whatever, I start from scratch. I, again, have to collect data, build my model, test it, validate it, so a very cumbersome and repetitive process. And maybe, look, during the first project, I learned a bit, I gained some experience and efficiencies. Maybe it's a bit shorter, my second project, but it takes a lot of time. And when you imagine every dot in this table is a potential use case, we as an industry would, I don't know, many decades we would need to build to get this fully filled with all those different opportunities. But there is a little bit of hope at the horizon, and which are foundation models. Right? Foundation models is the underlying technology, if you will, also underneath those ChatGPTs of the world, large language models, and so on. And on the left side of the screen, you can see how we develop AI today, right? What I tried to explain just a minute ago. And on the right side, you can see how we envision developing AI in the future. I believe it's a much more streamlined process. I believe we can eventually go even 10 times faster than today, because we don't need to start collecting data from scratch again and again. We just have like a large data pool. And this kind of approach and this new technology will help us with that quite dramatically. Yeah, so those new models are very, let's say, generalizable. You can work on a broader use case, not just detecting lung nodules, but for instance, detect everything what's wrong on the patient's lung. And then you can basically adjust it and fine-tune it for other use cases as well. But the most interesting thing, and where I'm the most excited about, right, with this new generation of technologies is it will open the door to multimodality. What do I mean by that? When you think about the way a radiologist works, and the radiologist reads your X-ray case, your MRI case, they are not just reviewing images. They also know about your history. They know about your latest lab results, right, and so on. So they know context. Today, AI doesn't know context, right? Today, AI is fed with a couple of images, right, and has a specific task to do. But the future will allow us, or this technology will enable us to feed such a model or a set of different models a variety of different data points about the patient to come to a conclusion, prediction, and so on. Yeah? So this is a very exciting field of research right now. Multimodality. Look, to closely wrap up, a few things that are very important when we really want to kind of embrace AI and lean into this, right, and adopt it. There are great technologies out there, but it's not just about technology. There are a couple of other things we have to make sure that are ready to get us moving. One thing is, we as healthcare, and especially in Europe, right, there's always a bit of a struggle when it comes to cloud technologies. Yeah? We don't want to expose our patient data in cloud systems and so on. But I think, right, just from a pure technology lens, we have to do this. Yeah? Because only in the cloud we have this compute capacity, right, just the pure processing power to deal with AI at a much larger scale. At the same time, right on the right-hand side of my screen, we still have to figure out ways to deal with a problem we have since many years, since we started the digital transformation of healthcare, and this is interoperability. Right? So it's a super complex topic, but we have to move on and get to more like interoperable IT systems in our health systems. Second is, where I spend also quite a lot of my time, is educating healthcare professionals, right? There's a huge trust gap, let's say, right, based on a knowledge gap, and often healthcare professionals just don't trust this technology and therefore don't want to touch it, right? It's taking away my job at some point, right? So that's the notion today. And I think we as an industry, we as vendors, we have to educate. Yeah, we have to demystify. We have to talk about what is deep learning, what is this black box. Not trying to make them data scientists, of course not, right? But they should understand the basics and hopefully with this start building trust. I mean, regulations, of course, is a very important topic, right? A lot of regulatory bodies around the globe are now trying to figure out how do I deal with regulation in healthcare with this new generation of AI, right? Large language models, generative AI, foundation models. And there are good conversations between the industry and those regulatory bodies which are really willing to learn and better understand this entire field. Look, and then one important thing is when you are about to implement AI in your hospital, in your healthcare settings, AI is a team sport, right? Which means is you need like a multidisciplinary team, right? Clinicians, more IT and data savvy people, and really work together on such kind of projects. This is very important. And of course, as always, you need a bit of money to make such things happen as well. Ladies and gentlemen, to close here, my question to you is, do you see a difference between the two classes on my screen right now? Probably not, right? But there is one. One of those classes contains hot water and the other one cold water, right? And the human eye cannot see this difference, but there is one, right? And I like this picture very much when I think about collaboration between technology and the human being, right? It's the same way between human being and AI. If we join forces, right? If we leverage human expertise, human empathy, right? And couple this with the power of AI, the power of data analysis, for instance, right? We can really make healthcare a very different thing in the future. So healthcare needs AI, right? To take away all those mundane, repetitive tasks from healthcare professionals to hopefully bring back what I call the human touch. Yeah, so something which I believe during the digital transformation so far we have somehow lost, yeah? But it's so essential to our industry. Thank you very much.
Imamo li pitanja? Evo, možda ćemo imati vremena za dva. What aspects of human touch can't be replaced by AI?
Well, that's a great question, to be honest. I think from a technology perspective, right, when you, in the long term, maybe there are many aspects that can be replaced. But the question here really is, what do we want to kind of move over to technology, right? And what is core to the human being and what do we want to keep ourselves, right? And I think we should definitely avoid giving away this doctor-patient relationship, right? I mean, from my perspective, everything else, fine. But this relationship between the human expert, right, and a patient, I think this is definitely something we should make sure somehow to keep, even if maybe technology will be capable at some point.
And the last one, how can AI being used to shift the focus from reactive to preventive care?
Yeah, that's a great question as well. And look, I think this is what we all try really to do, right, with putting technology in. I mean, I mentioned at the beginning the big issues we have with workforce shortage, with aging populations, chronic disease, right? And we have to find ways to leverage technology to move more left, right, to prevention. And I think AI can help a lot here. I showed you this one example, right, where you can interact very naturally with your own health and wellness history, right? So we have to have more such kind of solutions, more focusing on prevention, getting healthcare really out of the brick walls of the hospital and move it more to the home of the patient, right, to earlier stages, to eventually even avoid disease breaking out, right? I mean, this leads to another problem. We already have AI solutions today that can detect subtle changes in images, for instance, which is not a disease today, but could eventually become one in the future. Yeah, so the question is, if you spot something very early, do you already do something or do you wait? Right? If you do something early, you put even more stress on an already stretched healthcare system, right? But you eventually could help the patient earlier. So there's a lot of kind of notions to this.
That's all.
Okay. Thank you.
Thank you very much. Jan Beger.
Thank you.